Hey, it's Jessica DaMassa with WTF Health, and joining me right now I have Mark Scrimshire. He is the CMS Blue Button Innovator and general troublemaker in healthcare, but we'll get to that in a second.
Hi, Jessica.
Hi, good to have you. All right, so for those who may not know, the Blue Button's been around for 8 years. Briefly describe what this is and how it works.
Okay, that came out of a meeting that happened at the Markle Foundation, where the idea was very simple. If I'm a patient, shouldn't I be able to go to the website of the hospital I'm at and be able to download and take my data with me? And so somebody said it should be as easy as, press the blue button, and that's what it became.
Okay.
So that has existed for the last 8 years. It's still available today at CMS and the VA, where you can log into their website and download a text copy of your data. But I know people that have actually printed that out, and it's great, but it's 1,700 pages. Well,
right.
How do you make sense of that? So the objective for CMS was how to turn that into a data service. So Blue Button 2.0 is an application programming interface.
And that's where we're at now.
That's where we're at now.
Blue Button 2.0.
Yeah, so Blue Button 2.0 was introduced by the CMS administrator at HIMSS in March, and that's what I've basically been working on for the last nearly 3 years.
Okay, so tell me a little bit about this. So instead of having a paper copy now of my data, do I have an electronic copy of my data? What do I get?
Yes, so what we've built is really this application programming interface so that developers can build applications to make sense of that data. We're not trying to build the perfect diabetes app or the perfect hypertension app. We're really saying here, if this data is useful, this CMS claims data for these Medicare beneficiaries, let you use that. You use your expertise to create the great UIs, the great mobile apps, and so that's really what we built. But rather than going and inventing our own API, we actually worked with the community, and we saw that HL7 was doing some great things with the Fast Healthcare Interoperability Resource Spec, better known as FHIR. And so we actually worked with them to say, we need to publish this data, this claims information for patients. And so we worked together to actually define this resource specification known as the explanation of benefit and publish that. So we already know that there's a number of payers out there that have taken that and used that to, for example, share data with their data analytics vendors.
Okay.
So it's already got some momentum within the industry. It's just we've taken that and said, I'm a patient, I want to share my data using my HIPAA right of access to be able to give it to whoever I trust.
Okay, so unpack this a little bit more for me, please, because I'm very curious about the API part of this, because we have a lot of tech companies and startups that watch us, and they're like, ooh, data, access to data for free. So talk to me about the API piece of this. How does one access it? What do you have to do? Do you have to get vetted by CMS? Like, how complicated and painful is this?
There's two parts to it. First, the API is free for the developers, free for the beneficiaries to use. We have a sandbox environment where we have synthetic data, and that is available to anybody. Anybody can go and sign up and play with that. Just go to bluebutton.cms.gov, and you can sign up today and start playing with that fake data. But if you're serious and you want to create an app, then yes, you're going to go through a verification process with us.
Talk about that.
So really, I try and distill it down to something very simple. We want to make sure that beneficiaries' data is secure and they are in control of it. And what we want to make sure really is that there are no surprises for the beneficiary. In this day and age with Facebook and 23andMe and all of these things that are going on around privacy, we don't want the beneficiary having any surprises about how their data was used. So we want them to be able to say, yes, it's okay to share with this third party, whether it's your doctor, whether it's a payer. It doesn't matter. They have enacted their HIPAA right of access, which means once they've got that data, they can do whatever they want with it. If they want to put it on Facebook, that's fine. Just they should do it knowingly.
So how do you balance that? Because I mean, that's such a challenge, right? I mean, on one hand, you do want to verify and make sure that people's privacy and data are protected, but on the other hand, you do want to help enable these tech companies that can use that API in order to do some really cool things that then help health outcomes. So how do you guys balance that? What's your philosophy over there at CMS?
Well, I probably can't speak for CMS, but in terms of what I was trying to do in actually building this API is really to put the beneficiary in control. So rather than going and building our own mechanisms, we've leveraged standards. So if you've got a smartphone and you've got an app like you've got an app for posting to Facebook, you went through a process of saying, this is me on my Facebook account, and yes, I want this app to do this.
Right.
We have implemented exactly that. So we've made it really simple. It's like 3 steps for a beneficiary to be able to share their information. First, they have to have an account on mymedicare.gov. So they can go and sign up on mymedicare.gov and do that. Then they would go and pick an app. And when they're in that app, it's probably, if it's connected to our API, it's probably going to have something that says, do you want to share your Medicare claims data with us? And they click on that link, and they hand it over to us, and they'll enter their user ID and password, and then they'll get an authorization screen that says, do you want to share your data with this app? And only if they say, yes, I do, do we hand a key to that developer. And that key, together with the developer's credentials, they can use to get just that beneficiary's data. So if you're a developer out there, don't think that you can get at all of the 53 million beneficiaries 4.5 years of claims data for their hospital claims, their professional claims, or their medications. Sorry, no. You have to get the trust of the beneficiary that they want to say, yes, I authorize sharing with this app.
Okay, fair enough. All right, so what do you think then? Okay, so I mean, the beneficiary has to give their approval, and then the data will be turned over, right? And then, so, I mean, talk to me, I guess, about, from your perspective, the most optimistic outcome that can come from this. How do you see this being able to really help change health in the way that we consume health, or the way that Medicare beneficiaries consume health?
Yeah, so, I say, I have a funny accent, right? So I go to the UK. If I was to go into hospital or see a doctor in the UK, is my data going to get back to my physician in Maryland? Very likely not, unless I take it. That's really what we're doing with Blue Button, is putting the power of getting your data in your hands as a patient, and then letting you decide who you want to share it with.
Right.
So we really are pushing towards the fact that we as patients become the de facto health information exchange.
What are your thoughts about cutting the patients in then, on the sale of data, or on applications that are created that make use of their data? I mean, there's like if you're going to use my data, cut me in movement that's emerging.
Look, bottom line, personally, I'm all for it. If the the consumer is doing this knowingly and willingly, I think where we're at in the industry today is lots of data flows about us without us, and we are the only people that don't benefit in that whole big industry. So why shouldn't we, as we start to be able to aggregate our data, if we want to be able to effectively make money off it?
Right.
Yes, but let's do it. It's our choice.
Mark, it's always so nice to speak with you. I'm looking forward to seeing what happens. The days of Blue Button 3.0 are down the road a bit, I'm sure.
We're quite happy with Blue Button 2 as it's going right now. I mean, we actually have over 1,100 developers and 750 organizations experimenting in our sandbox. We have live apps today.
That's fantastic. And if anybody wants to take a look at it again, where can they go?
Just go to bluebutton.cms.gov and you can get all the documentation there. You can play with fake data. You can register an app in the sandbox and start experimenting.
Very good. Well, thank you so much for joining us. It's always a pleasure to catch up with you and hear what's going on in the world of CMS. And we do want to hear about those troublemaker stories, but I think we'll save that for another interview.
Thanks,
no problem. I'm Jessica DaMassa here at Health 2.0, talking about Blue Button 2.0 with Mark Scrimshire. Thanks so much.